I have literally seen really, really deep grooves in the shoulders of of my patients with larger breasts. It's because of their bra strap, as you can imagine. As the breast mass pulls on the bra and there's tension, there is weight pulling, and this is repetitive, and plus other factors, people can literally get a dent, an indentation, a groove in their shoulder from their bra strap. This is literally one of the telltale signs of a larger breast, what happens with a lot of people with larger breasts, and some of the health risks that come along with it. Guys, I'm Dr. Jen Caudle, practicing family physician. We are talking about some of the health risks that come along with larger breasts. I've got 9 for you. We just talked about the first, which is sort of like a grooving of the shoulder and indentation. But let me tell you sort of what can happen. I don't want to say as a result of that, but associated with that. If you can imagine so much weight sort of pulling on a bra, heaviness, etc., that causes a dent in the shoulder, you can also imagine that people with larger breasts may also have pain. We're talking neck pain, shoulder pain, back pain. Pain is huge with larger breasts, and it's nothing small. It actually really affects quality of life. I'm doing this video because every year I have, a few patients that come in, either wanting to talk to me about breast reduction surgery, like the possibility, or wanting to get like a pre-op clearance or a medical necessity form signed off because they would like a breast reduction because the size of their breast is negatively impacting their life. Pain is one way that it negatively impacts the lives of others. Also, along with that sort of neck, back, shoulder pain can be things like numbness. Remember, larger breasts carry a certain amount of weight. They are heavy. And so it really can put a lot of traction and pressure on things, hence the shoulder grooves with the bra strap, the pain, but also people can get numbness in their arms, in their fingers, and other places as well. But that's not it. Let's move on to a couple other things. Like if you imagine when we have, larger breasts, underneath the breast can be trapped moisture, okay? Because it tends to be relatively a closed space. It can get warm, it can get moist in there. What that can do is it can predispose a person to rashes or even infections. And that's something that I treat a number of times a year. Patients come in. Sometimes I see it more in the summertime, but under the breasts, that sort of moisture, warmth happens, and there can be yeast infections that develop, rashes that develop, etc. So there's definitely one side effect of larger breasts. Also, it becomes difficult to exercise. This is a well-known fact that when you have larger breasts, it can actually be painful / difficult to exercise maybe the way that you want to. And of course, not only does that impact just how you feel, right? Because you want to exercise, and if you want to exercise and you can't, or you can't do the things you want to, but also it negatively impacts your health down the line if you're actually not able to exercise properly because of your breast size. Interestingly enough, along those lines, some of my patients with larger breasts actually have trouble sleeping because they have a hard time getting comfortable at night. Sleeping the wrong way can cause pain or pressure in terms of their breasts, sleeping sometimes becomes like a whole thing, and it can be difficult to sleep. Also, the weight of the breast can cause shortness of breath, sort of fatigue, decreased exercise tolerance if you are not exercising as much because of your larger breasts, okay? And interestingly enough, another potential symptom is larger breasts have been associated with migraines in some people. And I can completely understand how that might happen, okay? If you imagine larger breasts really can sort of pull, add weight, add traction, add so many different things to our body and our musculature. And let's not forget to mention the psychological effects of having larger breasts, okay? I'm not going to say that there's any one sort of psychological effect that it has, because I think really every person with large breasts has a different sort of approach and feeling about it. But just understanding that larger breasts can absolutely affect someone's psychological state, whether for better or for worse, okay? And I think there's a wide range in what's possible with this. The point of this video is to let you know that having large breasts is a matter of health, right? Because they affect our health and can affect one's health. And as I mentioned in the beginning of the video, I have a number of patients that I see every year talking about breast reductions. I'm doing medical necessity forms and things like that. What I'd love for you to do is let me know if this is something that you can relate to, or something that you know, or have somebody in your family or friends that are dealing with. You've gone through breast reduction surgery, because what you write often helps other people. Please share this video also with other people. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on Facebook. Please like and follow my page. On YouTube, please subscribe to my channel. Click the little bell for updates. Also, I do daily videos also on TikTok, Instagram, etc. Please follow me at Dr. Jen Caudle, and go to my website at www.drjencaudle.com to sign up for my free weekly health newsletter. I'm Dr. Jen, guys. Take good care.